Yalimadad, everyone. Thank you all for joining Diabetes Workshop 2022. My name is Ambreen Sonawalla, and I'm a board member for the Archon Health Board of the Northeast region. Diabetes Workshop 2022 is a two-part webinar series on diabetes and nutrition. This is a very important topic as diabetes is a very common illness that is prevalent in our Jamaat, and many people are newly diagnosed each year. Today's session is part one of the series. The topic for today's talk is Understanding Diabetes. How do weight and nutrition play a role, which will be conducted by Dr. Ambreen Sonawalla. Dr. Sonawalla has completed her medical education from the Archon University, Karachi, Pakistan, and her residency in pediatrics from Arkansas Children's Hospital. She is currently a pediatric endocrinology fellow at Boston's Children's Hospital. Before we begin, I would just like to request everyone to mute themselves and turn off their video so as to avoid distractions during the presentation. We will be doing a question and answer session at the end of the talk. So if you have any questions, please type them in the chat box below and we will respond to those at the end of Dr. Sonawalla's talk. Next week, our workshop continues with a focus on managing diabetes and other chronic diseases with nutrition by Nermeen Virani, who is a registered dietitian and certified diabetes specialist. Please do register for the second talk as well. And with that, I would like to request Dr. Sonawalla to start her presentation. Thank you, and Yali Madid.
Thank you, Dr. Lana. Yalmad, everyone, thank you for joining us today. I'm really excited to see so many people here, and I'm really looking forward to discussing this important topic with all of you. So let's get started. I want to initially first share an outline of what we will discuss. I'll be focusing on what is diabetes, why is it important to know about diabetes, what happens in our body in diabetes, how are food, insulin, diabetes, and weight all linked, what happens if we have uncontrolled diabetes, and what can I do to either prevent diabetes or manage diabetes if I have it. I want to add that this is a forum for learning. My hope is that everyone who is attending this talk today will learn something that will help them take better care of their health. We will be talking about things like diabetes and obesity, which are medical problems, and we will treat them as medical problems. There's no blame here. We're not shaming anyone for having a medical problem. We want everyone to learn. And there may be things some of you may already be aware of, but hopefully everyone will learn at least a few things that are new. So before we start this talk, I want to poll the audience because I want to know sort of what are the motivations, what is bringing you all here to this talk. So you should see a poll on your screen right now. This is multiple choice, so you can choose more than one if you have more than one reason. I'm going to leave it open for a bit so people can answer. Give it a couple more seconds. Looks like everyone has answered. So let's go ahead. I'm going to share these results so everyone can see them. So this is sort of a pretty even distribution. So this is really great that there's diversity of thought here. About a quarter of people here have diabetes. A third of them have a family member with diabetes. Another third don't have anyone in their family with diabetes, but want to learn more, which is great. I'm really excited that you all are here to learn, and I really hope that you do learn. And then a proportion of people, about a fifth of people, are concerned about diabetes for themselves. So I'm really glad that you're being proactive in this. So let's move ahead. Before we get into our talk, let's talk about this one individual who has just been diagnosed with diabetes, and let's use this as a case through our talk. So a 45-year-old man goes to his primary care physician, primary care provider for a routine visit. His PCP does some tests and finds that his hemoglobin A1C and his random blood glucose are high, and says that he is diagnosed with type 2 diabetes mellitus. His PCP tells him that this is likely because of several factors, primarily because he is obese and because his mother also has type 2 diabetes. So now this person has lots of questions about his new diagnosis, like how could I have prevented it and what should I be doing to manage my diabetes now? So hopefully we can start answering some of these questions. So when I say diabetes, I'm sure all of you have heard this word, and I'm sure a lot of different words come to mind, some of which are on the screen, such as sugar or META or insulin, heart disease, glucose, and you may be thinking of other words as well. So sometimes our doctor uses certain words regarding diabetes, or our family members use some of these words when they're talking about our diabetes or our children's diabetes. And some of these words we may understand how they link together, but other words we may not. And so today, that's the goal is to try and demystify some of these words and demystify some of the questions around diabetes and explain how all of this is linked. My goal is that if people here can understand how diabetes affects their health or what happens in their body during diabetes, we will be in a better position to take care of our diabetes or prevent diabetes and better care for it. So starting off with some definitions, blood glucose is a term that I will be using frequently. You may have heard it before as well. It just refers to the level of glucose, which is a sugar, which is a type of carbohydrate. And we will discuss that in a little bit more detail later. And just the level in the blood. This can be tested using a glucometer, as you see on the slide here. And people who have diabetes will be familiar with this. And it can also be checked via a blood test. Diabetes, it's a medical condition in which the body is either unable to make insulin or does not make sufficient insulin or is not able to use the insulin or respond to the insulin. So somehow insulin is not able to act properly in the body. And this results in high blood glucose. That's the main part about diabetes, that's high blood glucose. Prediabetes is a medical condition which is somewhere between normal and diabetes. The blood glucose is not high enough to be diabetes, but it is not normal either. And the important thing about prediabetes is it presents a risk. And so this can progress to diabetes, but it can also resolve if we take the right steps. And lastly, hemoglobin A1C. Some of you may have heard this, especially those who have diabetes. This is a blood test. It's used to measure the average blood glucose over the past 3 months. So if we check a blood glucose now, we will know what the blood sugar or blood glucose level is right now. But a hemoglobin A1C will tell us, all right, over the past 3 months, what has my blood glucose been like? So it's used to diagnose, but also monitor diabetes because it gives us a long-term picture of what our control has been like. So the diagnosis of diabetes is based on symptoms and blood tests. And there are a few different blood tests that your doctor can do to diagnose and monitor your diabetes. The most common ones are fasting blood glucose, random blood glucose, and hemoglobin A1C, these three that are listed here. And if we recall, the person in our case had his fasting blood glucose and hemoglobin A1C measured to diagnose his diabetes. If you have concern about diabetes or want to monitor your diabetes, your doctor will be the one who will tell you which test or test to do. But typically, like I said, hemoglobin A1C is used to monitor. Now, these tests can be used to diagnose distinguish between people who have diabetes, those who have prediabetes, and those who have neither diabetes nor prediabetes. There are a lot of numbers on this slide. I don't want people to get confused. I've shared the cutoffs that I use to diagnose each of these conditions. But the important thing that I wanted to share was that there's a continuum between these three. And so someone who may have normal blood glucose, if they have risk factors, can start developing prediabetes and then move on to diabetes. And similarly, people who may be in the diabetic range, if they take care of the diabetes, manage it appropriately, as the doctor has recommended, their blood glucose can improve and their hemoglobin A1C can improve. It doesn't mean that the diabetes always goes away, but it comes under good control, similar to what a normal person or close to what a normal person might have for his blood glucose. A couple of some people who have diabetes and measure their blood glucose may be familiar with some of these numbers, but a couple of numbers I wanted to point out was a random blood glucose. So a blood glucose at any time of greater than 200 is usually abnormal. And that's something that we should know. So what are the types of diabetes? There are actually several different types of diabetes. The most common are type 1 and type 2. Today we'll be focusing on type 2, but I want to give us a little bit of background so that we can understand the difference. Type 1 diabetes is mostly seen in children or young adults. And in this type of diabetes, the body stops making insulin. And that's why the management requires insulin. Type 2 diabetes, which is the more common type of diabetes, and it is probably the type of diabetes that people that we know with diabetes are likely to have. This is mostly seen in adults, but more and more kids are being diagnosed with type 2 diabetes, and we'll talk about that in a little bit. In this type of diabetes, the body makes insulin, but it's not enough to meet the needs of the body. And management here is a combination of multiple things: diet, exercise, medications, and insulin. But unlike type 1, we don't necessarily require insulin. And of course, type 1 also benefits from diet and exercise. So why should we learn about diabetes, and why is it important? Diabetes is one of the most common chronic diseases, or what we call non-communicable diseases, in the US and the world. And the number of people, as you can see on the graph on the left, the number of people in the US who are living with diabetes has been increasing over the past many years. So this graph shows the total number of people with diabetes, and this shows that there is a small proportion of people who are undiagnosed. And so our goal here would be to make sure that we are keeping on top of our health, and if we have diabetes, then we're diagnosing it and doesn't go undiagnosed. The pie chart on the right shows the proportion of adults in the US who have these conditions. So a third, 34% of US adults in the US, and this is data from CDC in 2020, have prediabetes. That's a huge number. 1 in 3 people have prediabetes. About 13% of people have diabetes, of which 10%, not of which, but 10% of the population has diagnosed diabetes, and about 3% have undiagnosed diabetes. So as we can see, this is very prevalent. The prevalence is increasing, and it's important for us to be aware of this. As I mentioned earlier, type 2 diabetes is most commonly seen in adults, and we think about it as a disease of adults, but children can also get type 2 diabetes. I'd seen that in the poll, nobody here had said that they had a child with diabetes, which is great. But I really want people to also take home this message that children can get diabetes. The number of children who are being diagnosed with type 2 diabetes has actually been increasing over the past several years. And it's important for us to then be aware of the risk factors and try and keep our kids healthy as well, so that we can prevent diabetes. And if they do develop diabetes, then we should know how to help them manage the diabetes. This is usually diagnosed in older children, 10 years and older, very rare in children younger than 10, but of course in medicine, we never say never. Type 2 diabetes is worsened with increasing obesity. And the number of kids who are being diagnosed with obesity in the US has also been increasing over the past many years. And we think that that is one of the reasons why type 2 diabetes is increasing, particularly over the past 2 years in the pandemic. Obesity rates really increased. And a couple of important things to note here is that type 2 diabetes in children, although the type 2 diabetes in children and adults, there are a lot of similarities. A lot of kids with type 2 diabetes, more commonly than in adults, have more severe disease, and their disease can progress more rapidly. And so all the more reason to try and prevent this in our children, or if they've been diagnosed, be vigilant about controlling their diabetes. So we've been discussing about why it's important to learn about diabetes. Let's look at what happens in our body in a normal state and in people with diabetes. So in order to understand insulin, we need to talk about food. So our food has different types of nutrients like carbohydrates, fats, and proteins. And insulin and diabetes are mostly related to carbohydrates. So we will focus our discussion on carbohydrates. Examples of carbohydrates, as you can see, are anything that has sugar. So donuts, muffins, cold drinks, cakes, also bread, rice, potatoes, etc. So the food we eat is absorbed, goes to our stomach, is digested, and then that is absorbed. The carbohydrates are broken down into simple sugars like glucose. This glucose is then absorbed into our body and into the blood. Now from the blood, it needs to go to the rest of the body. And that is where insulin plays a role. The pancreas, this yellow organ that you can see sitting comfortably behind the stomach is the pancreas. This secretes insulin. Insulin is a hormone. And the pancreas makes insulin in response to the glucose in our blood that comes in when we eat. The function of insulin is to allow the body to use the glucose and the food that we eat. And it allows it to be absorbed and used for energy, and the excess, which is not used immediately, is stored as fat. Insulin performs both these functions. So if we don't have insulin, the glucose will not be properly used by the body. It will not be used for energy. It will remain in the blood, and so glucose levels will start rising in blood, and this is what happens in diabetes. That's why there's what we call hyperglycemia or high blood sugar in diabetes. And this is what causes all the problems in diabetes, primarily high blood glucose. I do want to emphasize here that insulin is a very important hormone. If we don't have insulin, that causes a lot of problems, obviously, such as in type 1 diabetes. But excess insulin can also cause problems, and we'll learn more about that in a bit. So now that we've understood what happens normally, what happens in type 2 diabetes? So most commonly, the problem leading to type 2 diabetes is that the pancreas, the organ which makes insulin, is overworked, and it needs to make more and more insulin. And if this continues, then the pancreas is eventually unable to do its job properly, or it's not able to make enough insulin to meet the body's needs, and a person develops diabetes. So let's look at what can cause the pancreas to be overworked, or what can increase, what can force the pancreas to need to make more insulin. As we learned, carbohydrates, when we eat carbohydrates, that causes insulin to be produced in our body. If we eat excess carbohydrates, especially high glycemic index foods, and we'll discuss what that is in just a bit, then our body needs to make more insulin in response. And so the more carbohydrates we have, especially high glycemic index foods, that puts more of a strain on our pancreas and requires increased insulin production. And of course, if this is occasional, the pancreas is able to deal with it. But if this is prolonged, then our pancreas eventually is unable to keep up, and a person can develop diabetes. So high glycemic index foods, this is something a term that some of you may have already heard. These are foods, these are carbohydrates, so they have glucose, but these are foods in which the glucose from the food, when it enters our body, is released very quickly. So when it's released very quickly, the blood glucose in our body shoots up very quickly, which means that the insulin needs to be produced very quickly and in a greater amount. As compared to low glycemic index foods, the glucose is absorbed or released slowly. There isn't a spike in glucose, there isn't a spike in insulin, and that's why they're healthier. Another factor that can cause the pancreas to work overtime is obesity. Obesity is, as we all know, a medical problem when someone has excess weight. And obesity causes insulin resistance. So insulin resistance is when the body has insulin, it's just not able to use it properly. It is resistant to insulin. And so the pancreas then needs to try and churn out more and more insulin to try and overcome the resistance, and that increases the stress on the pancreas. And if there's more obesity, there's more insulin resistance, and that can eventually lead to diabetes. Genetics or a family history of diabetes also increases our risks. If we have someone in our family who has type 2 diabetes, there's a higher chance that we may have inherited some genes from our parents that increase our risk. And again, if we recall the case that we discussed at the beginning of the presentation, the 45-year-old man with newly diagnosed type 2 diabetes, his risk factors were that he was obese and he had a family history of diabetes. And then lastly, there are other factors, some that we're still trying to understand, some like lifestyle, amount of activity that we do, exercise that can lead to diabetes as well, less exercise that can lead to diabetes. So we've all heard people talk about weight, right? When they talk about diabetes, you may have heard that, you may have heard someone say, your diabetes will improve if you lose weight, or if you've been gaining a lot of weight, you are at increased risk of diabetes. We've also heard that people who have diabetes should have less carbohydrates or less sugary food, and that sugary foods can increase weight. So what's the connection between all of these? And we're going to try and understand this. And we've already planted the seeds for some of this understanding in the past few slides. Again, as we've learned, when we eat foods with carbohydrates, again, bread, rice, potatoes, or any food with sugar like candy, sodas, our body releases insulin so that the body can use the sugar. If we eat more carbohydrates, the body needs to produce more insulin. And if we eat excess carbohydrates or, again, high glycemic index foods where the sugar is released very quickly into the blood and requires a rapid increase in insulin, this will require more insulin. That is why eating, and then if there's more insulin, that will cause obesity because the higher levels of insulin, not excess, the higher levels of insulin will store all the excess carbohydrates that we're eating as fat, and that causes weight gain. Second, when someone is obese, we just learned that they have insulin resistance. Again, insulin resistance is when the body is not able to respond properly to the insulin. It's resistant to the effects of insulin, and so the body needs to try and make more and more insulin. More weight, more insulin resistance, more insulin needed to be produced, and then at one point the body is not able to compensate and a person develops diabetes. So that's why losing weight can drastically improve this insulin resistance and allow some people to be able to improve their diabetes. Some people can come off of diabetes, type 2 diabetes, if they have type 2 diabetes, they can come off of medications or come off insulin if they lose weight. And then last, so someone who already has diabetes, if they eat a small amount of carbohydrates, typically their body is able to make the amount of insulin that is needed and maintain a normal or close to normal blood glucose level. If they eat more carbohydrates, again, especially high glycemic index foods, their body will need more insulin. But remember, in diabetes, type 2 diabetes, the problem is that our body is not able to make enough insulin to satisfy demand. And so the excess carbohydrates that we're eating will just stick around in the blood as glucose, and that will cause high blood sugar, which is called hyperglycemia. And that is why people with diabetes are recommended to control how much carbohydrate they eat. And we don't want high blood glucose because high blood glucose is what causes all the problems in diabetes. So we've been discussing obesity, nutrition, glycemic index of foods, and I want to elaborate on this a little further. The most common way we think about calories and weight is that calories in equals calories out. So if I burn as many calories as I eat, then I will maintain a stable weight. If I burn more calories than I eat, then I will lose weight. And if I burn less calories or eat more calories than I burn, then I will gain weight. And there is research that is suggesting that this may not tell the full story. Basically, that not all calories are created equal. Calories are very important and they're part of the story, but they're not the whole story. What is also important is the kind of food that we eat. And one factor to take into account in this is the glycemic index of foods, which, as we discussed, is a reflection of how quickly the sugar is absorbed into our blood from the food item. The higher the glycemic index, the more rapidly our blood glucose rises, so more insulin is released and more weight gain occurs. So, if you take 300 calories of a food with high glycemic index, it will have a different effect on our weight, on our diabetes, on our blood sugar level than 300 calories of food with low glycemic index. And this has been shown conclusively in research. This is just a starting list. We will be having a talk on nutrition next week, and hopefully we'll be able to go into this in a lot more detail, and hopefully you'll learn a lot more. But just to give you an idea of foods that are high glycemic index are things like soda, white rice, donuts, muffins, those that have sugar are all high glycemic index. So we've discussed so far what diabetes is, what happens in our bodies in diabetes, and how diabetes, obesity, and the food we eat are all related. So let's talk about what can happen if someone has uncontrolled diabetes, which means that blood glucose remains high. Uncontrolled diabetes can cause a lot of complications. Diabetes is a very important and common cause of cardiovascular disease and other non-communicable diseases in the world. And the good news is that managing this risk is in our hands, because good control of diabetes, even if someone has diabetes, good control can drastically reduce this risk. And taking preventative measures can reduce our risk of getting diabetes in the first place. So diabetes can affect almost any organ in the body. And again, I'm sure a lot of you may already know about or have heard about some of these side effects, some of these complications. People with diabetes, uncontrolled diabetes, can get stroke. They can have kidney disease, increased risk of infections, diabetic foot ulcers, and if extensive, those ulcers can lead to or require amputation of the limb. Also cause eye damage, heart disease, high blood cholesterol, nerve damage. In addition to damaging different organs in the body, diabetes also causes death and disability. So it's the 7th leading cause of death in the United States. In individuals who are over 50 years old, it reduces the life about 4.5 years. And it leads to disability 6 to 7 years earlier. And this is data that was collected by the CDC. So now that I've learned about diabetes and why it is important to know about and prevent or control diabetes, what should I do? When should I go see the doctor? When should I take my child to the doctor for concern for diabetes? The most important thing I want to emphasize is that we should maintain regular doctor visits, so regular annual checkups, or whatever checkups are recommended by the doctor. Because type 2 diabetes can be asymptomatic. A person can have type 2 diabetes for months and years without knowing it. And sometimes the first time that they learn about diabetes is when they develop a complication, when someone has heart disease, high cholesterol, stroke, infections, or any of those other complications, which is not where we want to be, right? Because by that time, there's already a lot of damage that has happened. And then depending on your own personal history, your doctor will tell you what tests to do, when to do, whether you have to check blood glucose or not. So all of that, your doctor will be able to tell you. And depending on your age and your personal history, your doctor might tell you that you need some screening labs, annual labs at another frequency to monitor or screen for diabetes. And because diabetes is asymptomatic, screening is very, very important. Of course, another time that we would want to go see the doctor is when we're experiencing symptoms of diabetes. So we should know what these symptoms are. If someone's having unintentional weight loss or fatigue, these can be signs of, obviously these can be signs of other things as well, but these can be signs of diabetes as well. And the reason is that if you remember, insulin allows our body to use the glucose for energy. If we're not able to respond to insulin and the glucose is remaining in our blood, we will not be able to use the glucose, we will lose weight, we will feel tired. Other symptoms are feeling very, very thirsty, increased urination, especially waking up in the middle of the night to urinate. And then dark skin around the neck is also it's a sign of insulin resistance. This is called, in medical terms, it's called acanthosis nigricans. And I've included a couple of pictures here so people understand what this means. Obviously, it depends on the tone of the color of the skin, and it might be harder or easier to see. But another thing to watch out for, I've had a couple of patients who have come and they've been diagnosed because their parent was like, oh, I see this on their neck. You know, another family member has diabetes. I know about acanthosis, so they brought them in. And then lastly, when experiencing significant weight gain is not a symptom of diabetes, but as we discussed, excess weight, obesity is a risk factor for diabetes. So if due to whatever reason, medications, anything else, if you or your child start gaining a lot of weight, you should go tell your doctor about it. And if needed, they may recommend screening for diabetes. So let's go back to the case we had where the 45-year-old man had been diagnosed with type 2 diabetes. So hopefully a lot of his questions have now been answered about, what diabetes is and what the hemoglobin A1C, random glucose, etc. are. And now he wants to know how he should manage it, what he should do to prevent, what he could have done to prevent it. So his PCP tells him that he should exercise every day, he should see a nutritionist, talk about a healthy diet, and start some medications. So what can we do? I'm first going to talk about, how can I prevent diabetes? And then I'm going to talk about how to, at least some factors about how to manage diabetes. So if I don't have diabetes, what do I do to prevent it? The most important things here are exercise, healthy nutrition, and reducing weight. The good news is that a lot of chronic diseases such as diabetes are preventable, and their complications are preventable. So if we make healthy changes in our lives, this will improve our health now and for the future. And prevention is always better than cure. And especially for children, if we can maintain good health now or establish good habits regarding nutrition and exercise, we will decrease the risk of health problems in the future. So regarding exercise, the American Heart Association recommends that all adults should exercise at least 150 minutes every week. And this can work out to about 30 minutes a day, 5 days a week. And this is moderate intensity exercise. So moderate intensity exercise are those that get us a little bit out of breath, which include brisk walking. So not slow walking or strolling, but brisk walking, biking, hiking, dancing, playing doubles tennis. If you're at home and you have a lawn, pushing a lawnmower counts as moderate exercise. And if someone is doing vigorous exercise, then 75 minutes per week, which is about 15 minutes a day, 5 days a week. But this is 15 continuous minutes, not a few minutes here, a few minutes there. This is 15 continuous minutes to get the full benefit. And vigorous exercises are like swimming, running, biking fast, playing sports, walking up the stairs. And walking up the stairs is something that some of us may have access to and be able to do. For children, the recommendation is 60 minutes per day of moderate to vigorous intensity physical activity. And both for adults and children, they are also recommending muscle strengthening exercises, weight-bearing exercises, such as weights. Again, climbing stairs can be a weight-bearing exercise as well. And one of the important things to note here is that exercise, we all know, has a lot of health benefits. And while one of the benefits may be losing weight, even if someone is not directly losing weight or not immediately losing weight, exercise still has a lot of benefits in our general health, but also on our diabetes. So exercise will directly reduce insulin resistance. It will improve insulin resistance, and it will decrease our risk of diabetes. The next factor, of course, is nutrition. And as we said, we have a talk next week on managing diabetes and chronic diseases with nutrition. So we'll go into a lot more detail then. But I just want to summarize some of the things we've already talked about in this talk today. Choosing low glycemic index foods, And we can also go, if you're interested in this more, you can go online and look up examples of low glycemic index foods. Choosing less processed foods, or choosing processed foods less often. Choosing foods with added sugars less often, and we can see the amount of added sugars on the nutrition label. There are foods that we all eat that are high in carbohydrates, such as rice, chapati. Rice has high glycemic index. So being aware of this and trying to make healthier choices when we can. Low carbohydrate diet or low carbohydrate content is now been endorsed by the ADA as a way to control diabetes. And we've learned why low carbohydrates help with diabetes. And of course, portion size control, appropriate number of calories. I want to emphasize that healthy nutrition is a family activity. If everyone in the family is involved and is trying to eat healthy, there will be higher chances of success. So there's this concept of food safe homes, which means that we don't bring unhealthy food into our home. So if we don't bring it in, then we or our kids won't be tempted to eat unhealthy food. If we bring healthy snacks in, we will be more likely to select healthier snacks.
It's a fine diabetes super.
And so these are all small ways to set ourselves up for success and ensure that we reach our goals of eating healthier, because this is not easy. It's not easy to exercise. It's not easy to always eat healthy. Not sure why, but unhealthy food always tastes better. But these are small steps that we can take. And once we start this and incorporate this into our routine, we will start feeling better. Our body will start feeling better. We're exercising and eating healthy. And then we will feel worse when we don't do this. And that'll be our motivation as well. Of course, we all enjoy our fries, our biryani and mithai and cake, and once in a while that's okay. But in our everyday meals, we should be consciously making a choice to select healthy foods. And then lastly, very, very important, reducing weight. So, through exercise and healthy nutrition, obviously we can lose weight. And even if we're not losing weight, exercise and healthy nutrition in and of themselves improve our health, specifically diabetes and our blood glucose as well. But of course, everyone's unique. There are some people who are trying and they just can't lose weight. Talk to your doctor about the best way for you to reduce weight, because it is hard for some people because of their body or their metabolism or whatever it is. And so some people, there are options for medications or surgery. So talk to your doctor about this if this is the right option for you. If you're at a place where you think you might need this. And then, so I have diabetes, what can I do? The same things apply regarding exercise, healthy nutrition, and reducing weight. Both people with diabetes and pre-diabetes. Same recommendations for exercise, same recommendations for eating healthy and trying to reduce weight. But in addition to that, some people with type 2 diabetes may need medical treatment. Some people can control their diabetes with just exercise, healthy nutrition, and reducing weight, but some people don't. And this will be determined by your doctor based on your health. And the medical treatment involves insulin, which is given by injection only, medications, which can be injectable or by mouth. Really important to keep up with regular doctor visits, because your doctor will be keeping an eye on how your diabetes control is, watching for complications, giving you advice and recommendations about what to do to improve your health. And people with type 2 diabetes have to get a hemoglobin A1C every 3 months to monitor their diabetes as well. Checking your blood glucose as your doctor recommends. And then we should know what our goal for blood glucose and hemoglobin A1C should be. So the American Diabetes Association recommends a hemoglobin A1C goal of less than 7%. However, some different people with, because everyone's diabetes is diverse, some people may have a different goal. So it's important to talk to your doctor about what your goal is and what your blood glucose goals are. Again, I want to emphasize here that if you have diabetes or you have pre-diabetes and you're exercising and not losing weight, or you are trying to eat healthy, have lower carbs, and you're not necessarily losing weight immediately, don't be disheartened, because it doesn't mean exercising and not losing weight doesn't mean that your exercise is not doing anything. As I said, exercise reduces or improves insulin resistance. And that in and of itself will improve your diabetes. And people with diabetes who exercise and eat healthy, some of them are able to come off of their medications. They're able to come off of insulin if they lose weight, exercise, etc. So it is pretty important. So by the end of our talk, hopefully you all learned a few new things here. Just some take-home points, especially at the beginning of the new year. Maybe we can start for ourselves setting some goals, some healthy goals in this year. We should be incorporating regular exercise into our lives, whether we have diabetes or don't have diabetes. Trying to make healthy food choices and knowing that the type of food we eat is also important in addition to how much we eat. Maintaining a healthy weight in the normal range, getting regular checkups with our doctor, because there's some things that are asymptomatic and things that we won't know until our doctor tells us about it. Taking our medications and doing blood tests as recommended by the doctor. I wanted to mention this earlier and I'd forgotten that there are people who we see, patients who we see, who don't want to take their insulin or their medications for diabetes because they are worried that if they start taking insulin, they will become dependent on insulin. Or if they start taking medications, that means that their diabetes is at the end stages and they're very, very sick. That may not always be the case. Talk to your doctor about it. But if your doctor recommends insulin or medications, it means that your diabetes will not get better, likely not get better without these, or it might get worse and you might have higher risk of complications. So it is safer and always better for our health. If our body needs the medications and insulin, then we should take it. And important to know that, again, diabetes can be prevented in some people. So if we make healthy food choices, healthy lifestyle choices, we can prevent this. And diabetes complications can also be prevented if you already have diabetes. So hopefully we can start with some small steps. Some of this can be overwhelming, but small steps always bring us to our goal. So thank you for your attention and for joining. We will open the discussion to questions. I see that we've been getting some questions in the chat box. I'm going to hand it over to Dr. Lana for questions there.
Thank you so much, Dr. Sonawalla, for this very informative session. We do have a couple of quick questions that we need to get to. I guess one of the questions that has come forward was what causes the body to resist insulin?
Yeah, excellent question. So there are several different causes of insulin resistance. One of the most common is obesity. So if someone has excess weight, is obese, overweight or obese, they will develop insulin resistance. And the more obese they are, the more insulin resistance they will have. There are some medications that can cause insulin resistance as well. So if you're taking medications for something else, again, that's why it's really important to keep up with regular doctor visits, because your doctor might go like, oh, you're taking that medication, I should screen you for diabetes because you're at risk for insulin resistance. And then the third is genetic. There are some genetic conditions in which people have higher insulin resistance. And, we have the genes that we have. That's what we call a non-modifiable factor. We can't change that. But then we can try and manage it.
That sounds good. Thank you, Dr. Sonawalla. I just have one more question. I think a couple of our members have been asking more about pre-diabetes, and that was also a conversation that you and I had. We see a lot of pre-diabetic people, not just amongst the patient population, but also in the Jamaat. So one of the questions was, how often would you recommend checking blood sugar and their A1C for people who are non-diabetic and who are pre-diabetic? And, I understand that this is a very case-specific question and it depends on that patient's other risk factors and genetics and the environment in which they live in. But do you have any recommendations as to regarding how often should they be getting their numbers checked? Thank you.
Yeah, very good question. And I'm really glad that you're thinking about this, right? Because it's important for us to think in a preventative mindset, like what can I do from now? So in general, people who are otherwise healthy there's no standard, there's no recommendation. We should not be regularly just checking blood glucose or hemoglobin A1C in everybody because it doesn't benefit. It's not that we don't want to, it's just that it doesn't benefit us, so why waste our time doing it? But there are certain people who they're at higher risk, should be getting the hemoglobin A1C checked. And the best person to answer this would be your primary care doctor. And the reason for that is they know your history, they know your family history, they know, the rest of your health story. And for everyone, the answer will be different. If someone is generally healthy, there's typically not much benefit in, getting a glucometer and checking blood sugar at home. It'll just increase your anxiety and give you a whole bunch of blood sugar numbers that are hard to interpret and won't really help you at all. And so the best way to handle this is go to your doctor and say, all right, this is my history, this is my family history, this is what my medications, etc. are. What do you recommend? How often should I check? The American Diabetes Association recommends that, people over a certain age with certain risk factors and certain history should be getting, say, annual hemoglobin A1C or at another frequency, but that all depends on your history. So your PCP should be the best person to answer this.
Absolutely. And for those Jamaati members who do not have a primary care physician or who need additional resources or have any questions regarding this talk, can just call our access line and we'll be happy to talk to them and provide them with any resources that they would need. We also got a question regarding what kind of insulin pump we should use. And I feel this would be very dependent on what that patient's or person's background medical history is. It's very case pertinent. So always ask these kind of questions to your own primary care physician, or if you have an endocrinologist, even better. So I would forward those questions to them. Somebody asked if parboiled rice would be good for diabetes. I don't know, Ambreen, if you want to comment on that, or if we should leave it for Nermin, our dietitian, for next week's session.
Honestly speaking, I'm not sure what the specific nutritional value of parboiled rice is. So I don't want to speak to that. But yes, next week's talk would be a fabulous place to bring up this question.
Sure, and I'll make sure that we ask Nermin this. We'll ask her to address this question next Saturday. And then Ambreen, we always hear people telling us that they feel that they get very depressed when their doctor tells them that you need to be started on insulin. I feel like there's a certain stigma, especially with the elderly population. I guess even with young kids who get diagnosed with diabetes at a young age, that insulin is something that it would mean that if you were to start insulin, you would have a grave diagnosis, or if you're not doing so well. How would you like to address this stigma with the Jamaat? I tend to hear it a lot in my practice and from the people I know around me as well. Thank you.
Yeah, thank you for that question. And I also hear this from my patients. So I completely understand that it's a scary process. It's scary to be told that you're going to be put on insulin injections because this may be something you're not familiar with, or you may have heard that some family member was put on insulin and then started developing kidney disease or something like that. Like, we may have heard some stories that might make us worried about this. But what I would say is, so nobody becomes dependent on insulin. If our body is not able to make insulin, it's not able to make insulin. And it needs insulin. Or if there's too much insulin resistance, it needs additional insulin from the outside to help. There are some people who they start on insulin and they're able to come off of insulin, especially if they are able to control their diabetes by non-medical factors such as exercise, diet, and weight loss. So it's not true that if you go on insulin, you will never be able to come off of it. Yes, if your diabetes already is so advanced and your body is not able to make any insulin at all, then your body needs the insulin. It's always helpful to talk to either your endocrinologist or primary care doctor, or if you have specific questions, you can reach out to us on this email address or through access. If you have some specific questions about insulin again, but I do want to emphasize here that if your body needs the medicine, you should take the medicine, and it's only going to help you in that situation.
Thank you, Dr. Sonawalla. One of the other questions that we just received was, is there a difference between white and brown sugar? The only thing I know is that brown, I think, is less processed. Do you have any comment?
Yeah, that's true. So brown sugar is less processed than white sugar. I don't know the specifics, like what the glycemic index of brown sugar is compared to white sugar and whether it's significantly better or not. My sense is that it's not like 10 times better, maybe a little bit better, but again,
Right.
Great question for tomorrow, for next week's talk, and we'll make sure to address it again then.
Right, and we're seeing a couple more questions regarding different kinds of sugar. I think these are very, very excellent questions. I think I'm going to just hold on to this one because I would really like Narmin to answer this particular question next week, since she is a dietitian and she can kind of address different kinds of products that we can use in our diet. Does anybody have any other questions before we end our session? You can raise your hand. You can unmute yourself. Feel free to do that at this point, or just type your questions below. Thank you. So we got another good question. Please comment on pre-diabetes and when to start medications given the Southeast Asian community. I think that's a great question.
Yeah, so like we said, pre-diabetes is somewhere between normal and diabetes. The person has probably some insulin resistance, some decrease in their body's ability to properly use insulin or make enough insulin, but not as bad that it has now developed to diabetes. There are some medications that are being used in pre-diabetes. Some of the data, some of the research suggests that it may not help that much. And some data suggest that maybe there might be some benefit. But in pre-diabetes, the most common thing that we recommend is diet, nutrition, and exercise. Diet, exercise, and weight loss. And I know that this sounds like, oh, it's just diet and exercise and weight loss. Like that's just like, tiny things. How is that going to improve my pre-diabetes? But we have seen, like when we see patients with diabetes, they are very powerful. Good diet, weight loss, and exercise are very powerful, and they reverse people's diabetes in some situation, reverse pre-diabetes, keep people really healthy. So I would definitely emphasize those, and then talk to your doctor. The reason I say talk to your doctor is because everyone's unique, and there's not a blanket rule that you have to take this medication if you have pre-diabetes. So you will get a better answer with a specific history with your doctor.
Okay, great. Thank you, Dr. Sonawalla. And somebody did ask what was pre-diabetes. So it's basically just when you are at a high risk of developing diabetes in the next coming years, so 5 to 10 years. And those are based, like Dr. Sonawalla said in a presentation, on a variety of factors. I don't know, Dr. Sonawalla, if you want to comment on what causes pre-diabetes, or if there's anything that we can look out for other than a weight.
Yeah, so same risk factors for pre-diabetes as there are for diabetes, which is excess weight, eating a lot of carbohydrates, high glycemic index foods, not exercising. So even if our weight is not very high, but we're very sedentary and we don't exercise, that also increases our risk. Family history, so there's someone in your family who has type 2 diabetes, you're at higher risk. And you should tell your doctor that there's someone in the family so that they will recommend screening as needed.
Thank you. I think those are very, very excellent points. I always recommend everybody to give a very thorough family history to their primary care physicians or an endocrinologist if they're seeing them, because we really get a good idea of what your risk is just based on your history. So that's very important. Again, I just like to say that we have a session by the nutritionist, Narmin Virani. She's a registered dietitian and she's a diabetes specialist. So not only will she talk about nutrition for the best kind of nutrition that can be used for patients who are diabetic and pre-diabetic, but she will also talk a little bit about nutrition that can be used for other chronic illnesses. So it's a very, very important talk. I encourage everybody above the age of 10 and beyond to attend this session. Parents with young kids who have any chronic illnesses will also very strongly benefit from it. And then she'll also go over some easy recipes that you can use. So I do see a couple of questions regarding what kind of sugar or products to use. I'll make sure that I put these questions down so that we can address those in our next session. Please do register for the next session. It's a different link than what you used today. So make sure you do that. And in the end, I would just really like to thank Dr. Ambreen Sonawalla, who took out time for us on a weekend to talk to our Jamaat about a very, very important topic that affects all of us. Thank you so much for coming today. We really, really appreciate it. Thank you.
Yeah, thank you, everyone. It was really great to have you all today. And the link for next week's registration is on the slide here as well.
Thank you so much. Yalla Madad.